Hello, good evening everyone. In this video, in this orientation session, we are going to get oriented to the concept or the events that is happening in the cardiac cycle. So, we start with cardiac cycle. Cardiac cycle, it means this cycle includes one heart beat. That means one systole and one diastole. So, in this cardiac cycle, we will understand what are the changes, the mechanical changes that is happening when the heart is like contracting, which is the systolic part, and when the heart is relaxing, that is the diastolic part. Now, the time or the duration for a cardiac cycle means the time that the heart takes to beat one time is 0.8 seconds only, is 0.8 second, is 0.8 second, not seconds, because it is less than 1 second. Okay. Now, this phase, systole and diastole, it happens both to the atria and the ventricle, means both the atria are also contracting, undergoing systole. The ventricles are also contracting, undergoing systole. Similarly, the atria is also undergoing relaxation, that is diastole, and ventricles are also undergoing relaxation, that is diastole. So, ventricles in systole, they spend out of this 0.8 second, they spend about 0.3 second, and the same ventricle in the diastole, which is the filling phase, the relaxation phase, it spends longer, which is 0.5 second. Whereas the atria, it spends about 0.1 second in the systole, in the contracted stage, whereas in the diastole, it spends maximum duration in the diastole, that is 0.7 second. So, this is what makes up the time for the cardiac cycle. Now, talking about the events, the mechanical stages that happens in the contraction and relaxation of the atria and the ventricle. So, here we are going to start understanding what exactly happens when the ventricle relax. First, we will start with the ventricle, then we will go to the atria. So, very in a crisp and in a very crystal clear concept manner, we will start with the ventricle. Let's say we are talking about the diastole of ventricles. So, the stages, what are the stages in diastole? It is not that at once the blood comes and fills the ventricles. No, it does not happen like that. The diastole of the ventricle, what does it include? It includes a stage called protodiastole. Protodiastole. In protodiastole, it spends about 0.04 second. Then there is a stage which is called as isovolumetric relaxation. Now, in isovolumetric relaxation, it spends about 0.6 second. Then starts the filling phase. Now, the filling of the ventricle, it starts at first, it is very fast. It is called as the rapid filling of the ventricle. It is the rapid filling of the ventricle, and we also call as the first rapid filling of the ventricle, which is about 0.1 second. Then it is the slow filling of the ventricle, which is 0.2 second. The slow filling is the one which is longer. Now, this slow filling is also called as diastasis. Now, this one, after this, there is a second rapid or fast, or we call it fast also, filling of the ventricles. So here also it spends about 0.1 second. So if you calculate, it comes to 0.5 second. Okay, the diastolic phase. This is a very important phase which we will come the importance of it, which we will study very soon. Now, think of the ventricles. Now, coming to the ventricles, if in a very simplified way, we draw the ventricles. Okay, this is the ventricle, this is the ventricle, and these are the atria. So, ventricles, from where does it receive the blood? Where does the blood come to the ventricle? Blood to the ventricle comes only from the atria. There is no other source by which the ventricles gets filled. They get filled only from the atria. There is only one place from which it gets filled, that is from the atria. And in the atria, via the atria or from the atria, which are the two structures from which it gets filled? It gets filled via the AV valve. So on the right side, we know we have got the tricuspid valve, and on the left side, we have got the mitral valve or the bicuspid valve. So this feeling phase is totally related to the atrium. Okay. Now, coming to the type of the feeling. Now, blood is a liquid, though it is not 100% liquid because it has got cells and it has also got little solid components and all, but it is roughly a liquid, right? It is overall a liquid. Now, when liquid has to flow from one region to another region, one region to another region, what is the first principle that it will follow? Blood flows via diffusion. It follows the rules of diffusion. It follows the rules of diffusion, which is the passive filling. Okay. Second one, ventricles gets filled both passively and active. Means there is filling of the ventricle according to the difference in the gradient, difference in the amount of the blood across along the gradient, and also there is active filling of the ventricle which happens due to contraction. Now we will understand what actually happens in this stages, and then we will correlate it to the diagram. Now starting with the first stage, which is the protodiastole. Now protodiastole, it is the phase just before the isovolumetric relaxation starts. Just before the isovolumetric relaxation starts, protodiastole happens. Now, next is the isovolumetric relaxation of the ventricles. Let us understand the step, then I will correlate it with the diagram. So, isovolumetric relaxation, as the term goes by, here the ventricular walls relax, but no change in the volume of blood happens. That means in isovolumetric relaxation, only the ventricles are relaxing. The myofibrils of the heart, the cardiomyocytes, they are just relaxing, but there is no filling of the blood. There is no change in the volume of the blood. Another important phenomena here we have to understand is that here the closing of semi-lunar valves happen. That is the second heart sound. So it is during the isovolumetric relaxation of the heart that we hear the second heart sound. This is the second characteristics of it. And what is the third characteristics of this isovolumetric relaxation? Here, the end systolic volume remains. Means that ventricle, this isovolumetric relaxation, just before that what has happened? The previous systole, the previous contraction has happened. So after the contraction, whatever blood has been ejected out, it has been ejected out. Now the volume of the blood that is present in the ventricle is the end systolic volume, which is about 30 to 50 ml. These are the events that happens in the isovolumetric relaxation. Next event is the first or rapid or fast filling of the ventricles. Now, here what happens as this, let me just draw the ventricle here, as this ventricles, this is relaxing, the ventricle is relaxing. So, the blood that is present, it is the end diastolic volume, the blood that is present in the ventricle, this is the end systolic volume. Now the ventricle are relaxing. Ventricle are relaxing means it is increasing in size. Now since it is increasing in size while relaxation, the pressure in the ventricles becomes lesser, much lesser than atria. Because when the ventricle is relaxing, the atria is getting filled with blood. So there is a difference in the pressure in the atria and the ventricle. So a time comes when the blood from the atria, here the blood from atria flows rapidly, very fast, in a very fast speed to the ventricles. This is the main event that happens in the first rapid filling. Here, just during the isovolumetric relaxation, the volume in the ventricle becomes more and there is no blood, only the end systolic volume. So the atria is now having more blood, more pressure compared to that of the ventricle. So this difference in the pressure between the atria and the ventricle causes blood to flow from atria to the ventricle. So the just main take is that pressure in the atria, because blood is there in the atria, pressure is more. So that pressure causes the or pushes the blood down via the mitral valve and the means tricuspid valve into the respective ventricles. Okay. Now, this is a passive filling. This is a passive filling. Why it is a passive filling? Because here the atria did not contract. This is passive filling. The first passive filling. Now, the second, what is the stage? The second one is the diastasis or the slow feeling. So now again, if we just draw the ventricle. So now the ventricles are getting filled with blood. As the blood is flowing to the ventricle, the volume of the blood in the ventricle increases. Here the volume of the blood in ventricles increases. So the pressure, because atria is now sending all its blood to the ventricle, so the ventricle is getting more and more filled with blood, and atria is now having less of blood because the blood is coming, getting pumped, getting like pushed to the ventricles. So atria is like dropping in pressure and the pressure is increasing in the ventricle. So the pressure difference between atria and ventricles reduces because now the ventricles are having more pressure due to filling of the ventricles. Therefore, blood passively, here also passively flows at a slow speed to the ventricles. Okay. Now, by this two process, like by the above two ways, about 100 to 110 ml of blood is filled in the ventricles. These are the passive process. Now, when this has happened, what actually happens? Now, for one last time, there is rapid filling. So, here what happens when there is like filling of the ventricle, which is happening, then there is all of a sudden, this is a ventricle, and here now there is like blood filled in the ventricle. Now, lastly, what happens? All of a sudden, there is like contraction of the atria. So, this last or second rapid filling of ventricle is actually by contraction of atria. Now, this is by the contraction of the atria, which is systole of atria, and this is active feeling about 20 to 25 ml of blood is pumped to the ventricle from atria by this active feeling. Okay, so here passively about 100 to 110 and actively almost around 20 to another 25 ml is being pumped into the ventricle. So here this feeling has happened in two stages. Now the ventricles, they are totally filled with adequate amount of blood. The ventricles are filled with adequate amount of blood, which is the end diastolic volume. Now, this end diastolic volume is about 130 to 150 ml. So, this is how the filling in the ventricle happens. First, passively from atria to ventricle, first in very fast speed, then it happens at a slower pace, which is a diastasis. After this passive filling is over, then the active filling happens via the contraction of the atria. So by that, another 20 to 25 ml of blood is filled. So both by the active and the passive process, the filling of the ventricle, the amount of the blood after the filling that remains in the ventricle is called as the end diastolic volume, which is about 130 to 150 ml. This is our diastole of the ventricles. Okay. Now, systole of the ventricle. So, once the ventricle is filled with blood, systole of ventricles. Now, when the ventricle is filled with blood, what does it have? It has got the end diastolic volume. End diastolic volume, say it is, for example, it is 130 ml. Now, systole also happens in stages. The first stage that happens in the systole is isovolumetric. It is also called as isovolumic. It means all the same contraction. Now, this isovolumetric or isovolumic contraction, it lasts about 0.05 second. Then is the rapid ejection, which is 0.1 second, and then there is slow ejection, which is longer, 0.15 second. Now, what are the events that is happening in the stages? The events that are happening is like, let's start with isovolumetric or isovolumic contraction. Now, think of the chambers of the ventricle. What is the ventricle? The ventricles, it is now fully filled with blood. Okay. That is the end diastolic volume. Now, when this is filled with blood, now the process of ejection has to start. Now, again, think, what does the ventricle has to pump out? The ventricle is pumping out liquid. It is pumping out blood. So, for liquid and gas to move from one region to another, it needs pressure. It needs pressure. So, what are the routes? What are the routes through which the ventricle will pump out the blood? Pumping in was only through the atria, right? Now, pumping out of the blood from the ventricle happens via two blood vessels. From heart, the blood goes to two circulation. The right side of the heart, that is from the right ventricle, the heart, it pumps out very basic, just in a very easy way. I am showing you the diagram. It pumps out via the pulmonary artery to where? To the lungs. To the lungs, right? That's where it is pumping out. Now, from the left ventricle, where is it pumping out? It is pumping out via the aorta to where? To the systemic circulation, to the periphery. Means all the structure from head to the toe, including the heart itself. Okay. So, here you see, both this ventricle now has to contract. So, the first stage of preparation to ejection of the blood via these two blood vessels is called as isovolumetric or isovolumic contraction. Now, what happens when the heart begins to contract? First event that happens is the closing of the AV valves that gives the first heart sound. Okay. So closing of the AV valves happens. Otherwise, there is a tendency, or there will be a tendency for the blood to go from the ventricle back into the atria. So that should not happen. That cannot happen. So there is like closing of the AV valve. So point to remember, before the filling stage started, we heard the second heart sound because of the closure of the semilunar valve, and before the pumping of the blood started, like the contraction started, at the beginning of the contraction of the ventricle, we heard the first heart sound because of the closure of the AV valve. Now, after that, what happens? After that, what follows is the rapid ejection. Now, one thing, at rest means when the heart is like not contracting at all. At rest, pressure in pulmonary artery is 10 mmHg, and the pressure in aorta is 80 mmHg. So this is the pressure that is always maintained. That is, even after ejection of the blood, this pressure is maintained in the blood vessel, because blood vessel are the structure that always has a column of blood. No blood vessel is devoid. It may have less, but it may have more. But blood vessel always need to have certain column of blood, otherwise they will collapse. Just like the alveoli of the lungs, it has to have air. Similarly, the blood vessel, the capillaries, always they have to have certain amount of blood, or else they will stop functioning, they will collapse. So now in rapid ejection, what happens? The isovolumic contraction or the isovolumetric contraction, it starts contracting without change in the volume, and after that, during rapid ejection, pressure, just at the start of the rapid ejection, pressure in right atria becomes greater than 25 mmHg, right? And pressure in left atrium, it becomes greater than 80 mmHg. One thing, remember, pulmonary artery all the way during like the rapid ejection, it also increases its pressure to 25 mmHg. So does the aorta. During ejection, the pressure in the blood vessel increases. They become same like that of the ventricles. So this causes rapid outflow of the blood from right to the lungs and from left to the periphery. This is like the basics, the criteria. This is what we need to get oriented to. Now, this is rapid ejection. So, after rapid ejection, just like the filling stage also, after like a lot of blood or most quantity of the blood gets ejected out, some blood gets ejected out slowly, which is slow ejection. Slow, via this slow ejection. Now here the ejection or outflow of blood continues at a slower rate. Here because during the rapid ejection, blood has been pumped out of the ventricle, so the blood in the ventricle has also become less, but again the pressure in the ventricle drops, but still there is little bit of squeezing out and pumping of the blood to the periphery, which is the slow ejection. Now this rapid ejection plus slow ejection is equal to stroke volume, which is about 70 to 80 ml. Now, what is stroke volume? It is the amount of blood pumped by ventricles per beat. Like every time the heart is contracting and relaxing, contracting, mainly per beat contracting, how much blood is pumped out of the end diastolic volume. Now here very quickly, just a mention, details about it you will study later, just in our orientation session. Just remember, this stroke volume is a fraction of end diastolic volume. True, right? So if these are your ventricles, so after the filling phase, the ventricle is filled up with blood, right? It is the end diastolic volume. So when the ventricles are pumping the blood to the periphery and to the lung, it is pumping out blood from this end diastolic volume. So this blood that is being pumped, it is nothing but the fraction of blood from the end diastolic volume. Now this is what is called as the ejection fraction. This is what we know as the ejection fraction. Means the volume of the blood that is pumped out from the end diastolic volume into the periphery and the lung. That is ejected out. That is the ejection fraction. And in normal condition, ejection fraction is 40 to 70%. It is not below that. If it is less than 40%, then it will signify some kind of cardiomyopathy. Okay, maybe heart failure, maybe hypertrophic ventricle, something it will signify. So for now, just this much is enough. This is our ventricular diastole and systole. Ventricular pumping out, and before that we understood the filling of the blood into the ventricle. Now, next what we have is the, okay. Kuldeep Soni, you answered aorta, yes, and isovolumetric contraction. Okay, yeah, those are right. So now we go to understand the atrial, systole, and diastole. So atria spends like 0.7 second in the diastole. Means it is spending maximum of its time in the filling of the atria. Now, when it came to the ventricle, what did we study? We studied that ventricles gets filled from the atria. The blood from the atria comes and fills the ventricle. And when the ventricle is contracting, that is the systole of the ventricle, it is like pumping out, or it is ejecting the blood to the periphery or to the pulmonary circulation, that is to the lungs. Okay, so that are the only two gateways. Now, coming to the atria. This is the atria. Okay. So, atria, from where does it get filled? Which are the ways by which it gets filled? So, this is our right atria and this is our left atria. So, right atria, it receives blood from the systemic circulation, via the superior vena cava and inferior vena cava, and this process is called as venous return. So, via the veins, the atria is receiving blood. When it is receiving blood from the systemic circulation, it is called venous return. Now, this venous return blood is what we call as the mixed blood or the deoxygenated blood. Okay, this is the story of the right atria. Now, coming to the left atria, from where does the left atria receive blood? Left atria receives blood again from the pulmonary circulation. This left atria is related to the lungs only. It has got no connection to the systemic circulation, to the periphery. So, it is via the blood vessel which we call as the pulmonary veins. And what is the peculiarity of pulmonary veins and pulmonary artery? Pulmonary artery, it is the only blood vessel that is carrying deoxygenated blood from the right atrium to the lungs. And pulmonary vein, it is the only vein that is carrying oxygenated blood from the lungs, that is from the pulmonary circulation, into the left atrium. Usually what happens? Arteries carry a pure oxygenated blood, right? So arteries usually carry oxygenated blood and veins carry deoxygenated blood. But pulmonary veins carries oxygenated blood to left atria from pulmonary circulation, right? Whereas pulmonary artery, what does it do? It receives deoxygenated blood from systemic circulation, which is the venous return, right? This is the only deviation. Okay. Now, atria, when it gets filled with the blood, what it does? It happens at a very slow pace. When this is happening, the AV valves are closed. AV valves are closed. When it is receiving the blood, the AV valves are closed. Okay, and gradually with the feeling, there is increase in the pressure. So throughout, the cardiac cycle, the atria is in the feeling phase only. Okay. Now, the contraction of the atria or the atrial systole or atrial kick is the last rapid healing phase of the ventricle, right? Only when there is active contraction of the atria, the ventricles gets filled by additional 20 to 25 ml of blood, and that is the systole of the atria. So these are the stages that we discussed. Now let us see and correlate it with the, let us see and try to relate it with the diagram of the cardiac cycle. So this is the cycle, this is the picture that designates the various stages as we have discussed. So if I zoom it out, just pull it a little below. I think it's visible. No. Okay. So what is happening in the diastolic stage? So see here in the diastolic stage, here you see the AV valves are closed, they are snapped, and also this is the semilunar valves that are closed. So here it is just after the protodiastole, when the heart has just begun to relax, when the heart has just begun to relax. So what we see here is isovolumic or volumetric relaxation. So once the isovolumetric relaxation happens, what did we see? There is elongation or enlargement of this cardiomyocyte of the ventricle. The pressure in the ventricle drops, and see here, the atria, it is receiving blood flow. Look at the arrows. It is receiving blood flow. So blood is coming and filling the atria. So pressure here increases, and because of the isovolumic relaxation, the pressure here decreases. The pressure here decreases. Okay. Now, the difference in the pressure now becomes so much high that the AV valves are now forced to open. See, the AV valves are now forced to open, and there is filling of the ventricle from the atria. The atrial valves are now coming and filling the ventricle. This is the diastole proper. This is the first or fast rapid filling phase. Okay, this is the diastole proper. Now this one, first it happens at a very rapid speed, very fast, and then when the ventricles are filled with blood, the atrial blood volume is decreasing. Now here the pressure difference decreases. Difference of what? Pressure difference between the atria and the ventricle decreases. So then the speed becomes slow. So this is all together the passive filling of the ventricles as we study. Okay. Now the passive filling is done, in which there is about 100 to 110 ml of blood in both the ventricles. Okay, done. Now the remaining blood that is present in the atria, how it has to come out? It is now coming out by the active filling processing. The ventricles are getting filled by the active filling by atrial kick, that is contraction of atria. So by that the another 20 to 25 ml of blood is filled. Now the ventricles are totally full with blood. Now after this atrial kick, which also coincides with atrial systole, now the ventricles are filled with blood, which is our end diastolic volume, which is about 130 to 150 ml. Okay. Now after that, what happens? Now here you see during the atrial systole, the AV valves are open. As we can see here, the AV valves are open because the blood has to come from atria to ventricle. But here, right, just when the isovolumetric contraction started, they was closer of the semilunar valve, and we heard the second heart sound right here, the second heart sound. So it still remains closed. Here, the semilunar valves, they still remain closed. Okay. Now again, the ventricles are contracting, which is ventricular systole. So just like in the isovolumic relaxation, the ventricle was a closed chamber. In the isovolumic contraction also, just like the isovolumic relaxation, in the isovolumic contraction also, the ventricles are closed chamber, means it is not changing the volume of the blood. So when the atrial is contracting in a closed chamber, see here, the AV valves are closed, the semilunar valves are closed, only the ventricles are contracting. So there is pressure generated. There is pressure generated in the chambers of the ventricle. Now this pressure becomes gradually more than that of the pressure in the pulmonary artery and in the aorta. Okay. As a result of which, the AV valve remains closed, but the semilunar valve, see, they open. As the semilunar valve opens, there is ejection of the blood. So the red one is the aorta, which is carrying the oxygenated blood, and this one is the pulmonary artery carrying the deoxygenated blood to the pulmonary circulation. So now the pressure in the ventricles are more than the pressure in this pulmonary artery and the aorta. Now here the rapid ejection happens. So first is the rapid ejection. After that, the volume in the ventricle decreases. So when the volume in the ventricle decreases, the pressure also decreases. This causes the slow ejection. So ultimately what we get is the stroke volume. So after the stroke volume is over, again it starts with the protodiastole. Again the same cycle happens over and over. Okay, this is our cardiac cycle, which now we have a very clear concept. Okay, now we have spoken so much about the increase in the pressure, change in the pressure. Now let's understand the very important diagram, which is the Wiggers diagram. Just get oriented to and understand what is Wiggers diagram, because it is totally related to the changes in the pressure that is happening in the heart during the event, which is contraction and relaxation. Okay, first thing about the Wiggers diagram. First thing about the Wiggers diagram. Wiggers diagram, write down. So, Wiggers diagram. First thing, always remember, Wiggers diagram denotes the changes in pressure of the left ventricle, left atrium, aorta, okay, and volume change in the left ventricle, okay, and shows the heart sounds. So, this is a diagram that is like integrating many things. Okay, many things it is integrating. Okay. So, very carefully see here this purple color line, that is highlighted here. This is the ventricular pressure. The events that are being shown here are that is of the ventricular pressure. This dotted line, just about this purple line, this is the aorta pressure. Okay. And this one which is below, this is the left atria pressure graph. This blue one, it is the ventricular volume change. This, of course, we are aware of. This is our ECG, and these are the heart sounds. Now, you may wonder why here we are only talking about the left side, not the right side. See, the events or the type of this Wiggers diagram, it is same for the right side also. But why we are talking about the left side? Because in the left ventricle, the pressure during the filling stage until the ejection stage, the increase in the pressure is from 0 mmHg to all the way 120 mmHg, a huge pressure difference. But in right ventricle, it is from 10 mmHg, means from 0 mmHg all the way only till 25. So, the size, the amplitude of this graphs are smaller on the right side. That is the only reason. The events that are happening are totally same. It is not different. It is not that right side, right atria, right ventricular showing some extra characteristics. No, the events are exactly same, but the amplitude, the height is much more. That's why we study the left side, which is easier for us to understand. Okay, now starting with the first one, we'll start with the ventricular pressure. So starting with the ventricular pressure change. Okay. So here this notch, this hump, before the hump, you see like this one, this is a hump. So this hump actually mean the feeling of the ventricle due to contraction of the atria. So this is the active feeling of the ventricle by the contraction of the atria. Okay. After that active feeling, what happens? After this active feeling, here the thing that happens is the AV valve closes. right? The AV valve closes. So this is the point that designates closure of the AV valve. Now, once the AV valve closes, what is the event that is happening? The event that is happening is isovolumic contraction. After the AV valve closes means the ventricle is having the end diastolic volume. Now it has to be pumped out. The ejection phase has to start. So it is the isovolumic contraction. So here you see the ventricles are contracting. The pressure in the ventricles are increasing. So this increase in the pressure in the ventricle, once when it reaches 80 mmHg, when it reaches 80 mmHg, what it does? It forces the aortic valve to open. Remember, opening of valve causes no sound. Only closing of valve causes sound. Okay. Now, after this valve has opened, what will happen? First, there will be rapid ejection. Like there will be further increase in pressure as we can see, and it reaches to a maximum of 120. So this is the rapid ejection. In a very fast way, the ejection happens and the pressure in the ventricle is highest. Okay, talking only about the ventricle. Just understand only about the ventricle. So active filling, closure of the AV valve, isovolumic contraction, ventricles are contracting, pressure is increasing in the ventricle all the way from 0 until 80. As soon as it touches 80 and starts increasing more, it forces the AV valve to open. AV valve opens, rapid ejection starts. When rapid ejection starts, pressure in the ventricle touches to 120 max. After that, the speed of ejection slows down, which is the slow ejection phase now starts. Okay. Now, when the slow ejection phase starts, the pressure in the ventricle also drops. See the downfall. Now, as soon as the pressure in the ventricle falls, the pressure in the aorta also falls. Now, the pressure in the aorta, when it falls to 80, it does not follow the ventricle anymore, right? So, here the aortic valve closes. On this side, on the other side, that is a pulmonary valve. Okay. So, here what happens? This rapid ejection, slow ejection happens, the aortic valve is closed. Now, since the aortic valve is closed, now there is no more ejection, no more stroke volume can happen. So, now the downfall in the curve that we are seeing, it is isovolumic relaxation. So, the ventricle is now again relaxing as a closed chamber. No blood is moving out or in. So, remember another point, during isovolumetric contraction and isovolumetric relaxation, no movement of blood happens from or to the ventricles. Another point to remember. Okay. No flow happens to or from the ventricle. So once the pressure in the ventricle starts dropping, it again comes back to 0. When it comes back to 0, again here the AV valve opens. So when the AV valve opens, what happens? What happens next is the filling phase. This is the filling phase of the ventricle. Then again the active phase starts and again the whole cycle starts again. I repeat very quickly. First is the active filling. Then this one causes the AV valve to close. Then there is an isovolumetric contraction, opening of the aortic valve, rapid ejection, slow ejection, closing of the aortic valve. Closing of the aortic valve followed by the isovolumetric relaxation. Isovolumetric relaxation, then again filling of the ventricle after opening of the AV valve. This is the change in the pressure. Like pressure in the ventricle from the 0 goes all the way to 120, pumps out the blood and again drops back to 0 and gets filled with blood. So there is always this change in the pressure and which causes the cardiac cycle. The ventricle. Okay. Now talking about the aorta. Aorta, as you see, when there is no feeling happening, this aorta, it is maintaining at a pressure of 80 mmHg, right? So when the ventricular pressure crosses its 80 mmHg, the valve opens and pressure in the ventricle increases, the pressure in the aorta also increases. Then after rapid and slow ejection, the pressure in the ventricle decreases, the pressure in the aorta also decreases, but pressure in the aorta never decreases below 80. It always maintains a pressure of 80 mmHg in itself. Okay. And then again during the feeling phase, it is like slightly, it like fluctuates between 80, 70 or 75, 80 like that, but never below that. Okay, why that is happening? Because aorta is made up of smooth muscle and there is always a column of blood. As I told you, there is always a column of blood in the blood vessel. So that the blood vessel that stays in the blood vessel that contains the blood, the little bit of blood that stays in the blood vessel, it is always squeezed by the smooth muscle of the blood. That's why there is a constant maintenance of pressure of 80 mmHg, about 80 mmHg in the aorta. Okay. Now, talking about change in the pressure of the atria, which is done by studying the jugular vein, which is also the jugular vein pressure, which is very important. So here you see, okay, we use on the right side, it will be easy for us. There will be no thing. So this A, it is the atrial pressure due to contraction of the atria. When the atria contracts, the pressure that we get here, we call it A. Okay, we'll study this separately also after this class, means after this diagram for a little bit. Okay. Now, when the ventricle is pumping out blood, it is ejecting, then also you see slight increase in the pressure of the atria, which is the C. So this is during ventricular ejection. Now, after ventricular ejection, you see a certain fall in this pressure in the atria. This is called as the X descent. X descent means all of a sudden volume in the ventricle decreases and this causes drop in the pressure of the atria, because atria is physically attached to the ventricle. So when the ventricle all of a sudden it relaxes, the pressure decreases, the atria also feels the pull from the ventricle. So the pressure in the atria drops, which is the X descent. Then again, when blood comes from the atria to the ventricle and the ventricle is getting filled, then there is slight increase in the atria. Then there is slight increase in the atrial pressure, which is the V. This is due to the filling of ventricles. Now, this is again followed by a slight decrease, which is the Y descent. Now, Y descent is because the blood from the atria has come to the ventricle. After filling, the blood from the atria has come to the ventricle. The atria is now almost empty. Never totally empty, but almost empty. So, this is why we see this Y descent. Okay, so this is very important, like jugular vein pressure study gives us this understanding of this atrial pressure. In various clinical conditions, these are affected. So when you study the main course, all this clinical thing will also be told to you. Okay, in the orientation class, just know this basic things to lay the concept clear. Okay, now coming to the ECG. ECG is our known thing. We have done it yesterday in the last class. So electric event follows the mechanical event. It is first the electric event that happens, which is followed by the mechanical event. So first you see here the atria receives the wave of depolarization, that is the P wave. So after P wave, you actually see there is contraction of the atria, which leads to the atrial field. Okay, after that there is this PR segment, and here P to R, it is a PR interval. So in PR segment, what do we see? We see there is just passage of the impulse, which in which there is no contraction. Now, it is during the isovolumetric contraction or just before the isovolumetric contraction, almost at the end of the R wave. End of the R wave. If you remember, what was the significance of the R wave? R wave denoted depolarization of the maximum area of the ventricle. I repeat, QR is complex, it is a depolarization of the ventricle, but especially R, because Q is almost invisible, though we can see a Q here, but it is not very prominent by our naked eye. So Q means the depolarization of the bundle of His, the beginning of it, the septum part. And after R, like almost when R is completed, that is the depolarization wave has been on the right and the left ventricle, we get the wave, that is the upward increase in the pressure. As we see the increase in the pressure, isovolumic contraction happens. That is after the R wave, because first electrical event, then the mechanical event. Okay. Now, during the rapid ejection, the segment that follows, it is the ST segment. You see here, it is the ST segment. That's why the J point and the ST segment are very important to study from the ECG graph to understand any kind of cardiac condition. Now, after the rapid ejection is over, what do we get? We get the onset of the repolarization. So, after this, almost at the end of the T wave, we get the isovolumetric relaxation, the downward stroke. Okay, and then what we see is the TP interval. The T, because this is a T wave, this is a TP interval during which there is relaxation, which is the filling phase of the ventricle. So, this is its correlation with the ECG. Now, coming to the heart sound, we know that in normal condition, there are two audible heart sound. First heart sound and second heart sound. So, from the Wiggers diagram, we see that the first heart sound is due to the closure of the AV valve. We see here closure of the AV valve. And second is due to the closure of the semilunar valve. Here you see it is the closure of the aortic valve. And sometimes even in healthy person, these two are audible in a healthy person. Okay. Now, when there is filling of the ventricle, there is vibration. When there is contraction of the ventricle, there is vibration. Now, this third phase is heard during the, if you see it is heard during the filling phase. Sometimes in young athletes and thin subjects, it is audible. Means a normal condition or pathological condition. Okay, it can be, but in most of the cases it is inaudible. There is another heart sound also which is abnormal. Like fourth heart sound is due to atrial systole. Okay, due to atrial systole, or not due to, we should say during atrial systole completion. That is during the filling phase of the atria. Now, this is if audible is a clinical condition. Because during the completion of the atrial systole, okay, and during the filling of the atria, that is completion of the atrial systole means during the filling of the atria, right? There should not be any sound. If there is any audible sound during that stage, it will be only in clinical cases. So this is our Wiggers diagram, change in the pressure. The last one remaining is the change in the volume. This is very easy. See, this blue one, when the ventricle is like getting filled with blood, see, there is increase in the volume. The 50 ml, it is the end systolic volume, that is after the ventricle ejected blood, what was remaining is the end systolic volume 50. So during the filling of the ventricle, it reaches by active and passive, say it reaches to maximum 130 ml, which is the end diastolic volume. So during the ejection, see, there is like a rapid fall in the blood volume because the ventricle is pumping out blood again during the filling phase. The diastolic phase, first there is fast or rapid filling, then there is diastasis, then there is like diastasis. Both this they fills up the maximum, and then during the atrial kick or the active filling, you see there is another 20 to 25 ml of blood that is filling the ventricle. So this is the ventricular volume curve graph, in which first the pressure increases due to filling of the ventricle, then it drops due to ejection, and then again it increases in two stages. One during the rapid filling, second rapid filling and slow filling, that is the passive filling, and then second during the active filling. This is how the volume curve changes. Okay. Now, just for our understanding, better understanding purpose of the jugular vein pressure, the normal one, we will see this graph. So, these things are clinically very important. These things are clinically very important. So, this is the change in the atrial pressure. So, atrial pressure graph is the jugular venous pressure in normal condition. Today we will understand only the normal condition because we are getting oriented to that. Later we will see the clinical conditions. So this A wave, what is the A wave due to? A wave is due to the contraction of the atria. This is due to atrial contraction. Now this, it gets affected in tricuspid stenosis or atrial fibrillation. Okay, this is the A. Okay. After that, what is the C curve for? As you see, it coincides. C curve is coinciding with what? C curve is coinciding with the contraction of the ventricle. So, C, it is due to contraction of ventricles. Okay. Then we have the X descent. Now, X descent is due to suction effect. Suction effect means what? Suction effect means that when there is like emptying out of the ventricle, like when there is emptying out of the ventricle, the ventricles, they are connected to the atria, right? So when there is like emptying out of the ventricle, this will pull down. Emptying of ventricles during ejection, what it does? It pulls down the atrium, as a result of which there is drop in atrial pressure, which is the X descent, which is the X descent. Okay. After that, what do we have? After that, we have the V wave. Now, this V wave, it is due to feeling, like as we can see here, the V wave, it is due to the repolarization and feeling of ventricles. The feeling of ventricle, it causes like little bit of upward push to the atria via the bicuspid or the mitral valve, as you can see here. Now, after that, what is the Y descent? Y descent is due to emptying of atria. Okay, the pressure in atria drops due to ventricular feeling, the active feeling mainly. Now this one, this Y descent, it becomes steeper in stenosis of mitral or any kind of AV valve, I should say, in AV valves. It will be more prominent in the mitral valve stenosis, but it is also affected in the stenosis of the tricuspid also. Okay, both tricuspid and bicuspid. Okay, so this is our understanding of the jugular vein pressure that depicts the atrial pressure. Okay, so next day we will get oriented to cardiac output and atrial blood pressure, another essential topic of the cardiovascular system. So I'll be seeing you after a couple of days, that is on Tuesday. Monday I will not be having the orientation session. I will see you again on Tuesday. Till then, bye. Good night.